Imagine for a second. Something so tiny, almost invisible, slips under your skin. You don't feel it at first, but then it grows, feeds, and lays eggs, right inside your body. Sounds like a horror movie, right? But it's not. This is what happens with a Jiggers infection. Today, I'm diving into the disturbing truth about Jiggers, what they are, how they get under your skin, and why removing them is both shocking and sometimes life-changing. Welcome back to Medicera. This is where I break down real medical issues in simple, honest language. Today's topic, it's uncomfortable, but it matters. Let's get into the truth behind Jiggers. So, what are Jiggers? The villain here is a tiny parasite with a big name, Tunga penetrans, or the sand flea. These fleas love dry, dusty, sandy places. If you walk barefoot on infected ground, especially in rural or unhygienic areas, the female flea can burrow straight into your skin. It's not picky, under the nails, between the toes, anywhere it can get in. But it doesn't just bite and leave. The flea stays. It feeds on your blood. It gets bigger. And then it lays eggs inside your skin. That's when the real trouble begins. At first, you might just see a tiny black dot. Easy to ignore, right? But soon, the area gets painful, swollen, red, and super itchy. In severe cases, you might see clusters of these fleas in one foot. Walking becomes agony. Some kids even stop going to school because of the pain. And if you don't treat it, bacterial infections can set in, making everything worse. Now, let's talk about the part that makes everyone squirm: removal. The only way to get rid of a jigger is to carefully extract it from the skin. Doctors use sterile needles or blades, but in many areas, people try to remove them with pins, thorns, or whatever they can find. Doing this without proper tools can cause severe infections, tetanus, or even permanent damage to your skin. That's why going to a professional matters. Safe removal reduces pain and stops complications before they start. So, how do you treat and prevent jiggers? Treatment means sterile extraction, cleaning the wound, maybe antibiotics or a tetanus shot. Prevention is even better. Always wear shoes, keep your feet clean, and avoid walking barefoot in risky areas. Simple habits can save you a world of pain. But here's the bigger picture. Jiggers aren't just a medical problem. They're connected to poverty, lack of awareness, and poor sanitation. So instead of judging, let's spread awareness and offer help. Sometimes the smallest parasite can cause the biggest suffering. If you learned something new today, share this video. Help me spread the word. This is Medicera, bringing you real medical truth with care. Stay healthy, stay aware.